let's get down to the last chapter of this third week of class. So we're going to talk about depression and exercise, just like we did with anxiety, just like we did with stress. We're going to talk about depression and what it is, and then we're going to get through that, and then work into how exercise will affect it. And I mean, pretty commonplace theme here is that just like stress has a, exercise has a positive effect, anxiety has a, exercise has a positive effect on anxiety. Exercise has a positive effect on anxiety. You're probably going to see here that depression is going to have the same thing as well. All right. So let's get down to how everything kind of works here. All right. So first off, when we look at, depression in its own self, what do we want to think about in terms of, just like day-to-day looking and things like that. So obviously everybody has been, depressed in some way. We felt unhappy, felt unlike ourselves, kind of feel out of place in sorts. So, um, you know, what do you do? The thing you want to think about though is what do you do when you're having, those moments? Um, and how long do you want to wait before it becomes serious? Because obviously we all know our own self, we all know our bodies, we know everything about what we're feeling, but when is it to the point that we need to either see specialized help, or when do we feel like it's really become a seriously depressive part? Okay, so those are just some things to think about, and just because on a certain day you feel unhappy or you don't like feel like or like it says here, how you have the blues for the day or a part of the day or whatever, it doesn't mean that we have to go seek help right away. But when's the right time, and who are the best people to see? Well, that's going to be dependent upon you and how you're continuously feeling, because each, again, just like we've always talked about throughout all these other chapters, everything is individualized to the person. So the first bout for one person might really need them to go see a specialist. The next bout, for another person, it might be 30 days. It could be 4 months, before they finally are like, wow, something's really not right here. And that's just a different way of thinking. Okay. So when we talk about depression and being a mood disorder, well, really, like it says here, disorders that influence mood regulation beyond the usual variations between sadness and either happiness or excitement. All right. So depression can be very much on a scale, all right, slightly to high, but the variation part of that definition really comes into play here, because you have that sadness and then you have that happiness effect. All right, and it's that grand scheme of things where mood in between those two states is really where that depression lies. All right, so it's again, it's a mood disorder. All right, so some of the depressive disorders that we work with are major depressive disorders, bipolar disorders, and then now you have two words, dysthymia and cyclothymia. All right, and for each one of those, there's a specific difference between them all. All right, so when we're looking at it from the standpoint of major depressive disorders, like it says here, it's depressed mood. There's a sense of a loss of interest, of pleasure. You kind of just feel out of it of sorts. And but again, they're disorders, so that means that it's been going on for a little while now, and that it's becoming a problem. All right, bipolar is episodes of what we would call, or we would say, manic episodes, or like it says here, mixed periods of mania, and then depression. All right, so that's bipolar. So when we talk about people being bipolar, you're talking about two extreme ends of the spectrum. One minute they're just like woo, woo ha, and the next minute they're like down in the dumps. All right. Dysthymia is a chronic form of depression. Major depressive disorders are depressed moods, but they're problems that are there. But when you get into this dysthymia, it's chronic forms of depression. So that's where we're now saying, okay, there's no more of these acute bouts. Okay, now we're saying, uh-oh, this is becoming an everyday thing, an every hour thing, and you can kind of see, I shouldn't say you can see it in people, because it can be tough sometimes, because depression can hide. But there's these personality changes that can affect you, that can affect the viewer, and you can kind of see like, okay, something's definitely not right here. Okay, and then cyclothymia is, like it says here, it's manic and depressive states, but it's not as intense as something like bipolar disorders or major depression disorders. So again, going through cyclo, so kind of going again up and down, but what we're saying here is it's not as intense. So it's there, but it's just kind of like on that like vicious cycle of going through a really good moment and then kind of like falling back into ways, and then you have a really nice set of moments and then fall back in your ways. So it's kind of it's kind of like that cycle. All right. So what are some things that what are some factors or that go along with depression? So if we're seeing here, there's a laundry list of different things here: feelings of sadness versus elation. There's guilt and worthlessness. There's food issues where now you're starting to disturb your appetite. Your sleeping becomes jacked up and really changed and for the worse. That now starting to be more fatigued, lack of energy. You really have a hard time concentrating. So if you're a student and you got those depressive moments, it's really hard to really focus on what's the task in front of you. There's a loss of interest in some things or all things. You start having problems remembering things. And then if it gets really bad, like if depression really starts to kind of tail off really bad, then we have the next two things that are really a cause of concern. But there's those suicidal thoughts, and then lastly, and then you start talking about hallucinations from aggressive depression. All right, so you can see here that you have these feelings of sadness and guilt and worthlessness, things like that. But if those go on too long, coming over here to these thoughts of suicide and hallucinations, that's a bad, those are triggers for leading to that point if it does not get changed. All right. So when we talk about major depressive disorders, like it says here, there's criteria that, we kind of have to fit into this kind of a mold. And this is actually developed by, the Department of Health and Human Services. So, if they're, you're looking at it from the government standpoint, this is what they're saying is that number one, you have a depressed mood, most of the day, nearly every day. And that's usually by self-reporting or by observations that are made by other people. All right. There is a diminished interest or diminished pleasure in all or most activities, again, self-absorbing or self-reporting or observing by another person. There can be some significant weight loss. And this is, again, it's weight loss, but there's usually no dieting or there's no weight gain. There's some problem with that. And what they consider that to be is a change of greater than 5% body weight in a month. Okay? And then and then every day you just start to have those feelings of, either a decreased or increased appetite depending upon you as the person. All right. Then there's the, either insomnia, so you're having problems sleeping, or hypersomnia, which you're just sleeping too much. So you can see it's like if you look at these criteria, you're on the far ends of these spectrums. Either you're high or low, and there's no in between. And that's usually what makes us not depressed, is that we're in that in between stages. But anyway, psychomotor agitation or retardation, and again, that's observable by others. Again, slowed. Things are becoming more slowed down. You're not as upbeat, maybe. All right. There's that fatigue and the loss of energy. So that's even when it's not even needing to like clean the house or go to work. It just there's nothing that you're supposed to be doing, and you're just feeling like out of it. All right, and just tired. There's those feelings of worthlessness or sometimes like excessive or inappropriate guilt. So, putting something back on you. An inability to think or concentrate. So again, we talked a little bit about this before in those accompanying depressions last slide. And then recurrent thoughts of death or suicide. So really, really problematic as we go down that line. Okay. And then on the bottom there's a note. And basically it says major depression may be diagnosed when 5 or more of the symptoms have been present during the same 2-week period and represent a change from previous functioning. And it says at least one of the symptoms is either depressed mood or loss of interest or pleasure. So you can see here that in a 2-week period, there's been changes for the worse that we're seeing of these symptoms, these signs and symptoms. So, major depressive orders are things that we do have to take seriously, and just by pushing them aside is not going to do anybody any good. All right. So looking at prevalence here, mental illnesses rank second only to cardiovascular problems and disease burden in industrialized nations. So like the U.S., places in Europe, China, or just say China, but we could also say, many large countries in Asia. All right. And every year, approximately 20 to 25% of U.S. adults suffer from a diagnosable form of mental health problem. It does cause a huge money concern, but of those 20 to 25% diagnosable, the interesting part about that is that number, from my perspective, is probably slightly higher simply because of the fact that that's just, that's diagnosable. There might be people out there who are undiagnosed. There might be, an inability to diagnose in the moment. So you can see that that number can fluctuate very much. All right. So, really with the prevalence though, but what's the cause? Well, that first, and you I pause there because it's kind of hard because it's not well understood. Yes. But if you sit there and you kind of think to your own self and you're like, well, what are some of the causes of depression? Well, think about a time where had an issue or, because everybody has, and it doesn't matter what it is because that's on your own personal self. But think about it in your head and it's like, well, what caused me to be depressed in that moment? Or for that time frame or whatever it is. It could be a death. It could be a divorce. It could be, like for a pregnant mother, it could be a loss of a child. There's so many things that could happen. So it's not well understood because to me, it's so broad. There's so many different things that can happen and it's so individualized. All right. But really now we're talking with causes, there's an interaction between, again, that physiological part and that psychosocial part. So again, mind, parts of everything, and then movement parts of everything, and then just functioning, cellular functioning part, physiology part. All right. But again, like I said, responses to stressful events vary by every individual. It could be anything from social support to heredity to coping skills to what you're engaged in the moment, who you're hanging out with. So there's so many different factors that come from that. All right. With treatment, though, this is the scary part: is that it's often untreated. Okay, but again, like we talked about in the first slide when we were kind of going through the introductory part of everything. Exercise, physical activity. Which exercise is a form of physical activity. It's structured. All right, where physical activity is more just about the general movements, but physical activity can be useful. All right. And if you look at that little, blue part right there, data generally support at least a modest improvement in mood symptoms for patients with major depressive disorders who engage in aerobic exercise or resistance training. So you can see there that, what we're saying is that, regular exercise can help. All right. And if exercise can help with that, we want to try to get people on board to not just buy in, but feel good about themselves while they're doing it because the goal here is obviously that this person has someone they can rely on, as in like the future trainer, strength coach, whatever. But the problem is that they can't be reliant because they got to be able to feel these ways on their own as well. All right, so we have to look at it from that perspective. With measurements here, there is something that you can do in terms of, like I said, standard classification criteria through the Diagnostic and Statistical Manual of Mental Disorders, and that's actually put out by the APA, the American Psychological Association. And then there's other factors that you can do, like self-reportings, like the Beck Depression Inventory, Zung self-rating depression scale, and then there's other ones that maybe a clinician might give a report to somebody. But a sample, and this is from the Center of Epidemiological or Epidemiologic Studies depression scale. And if we blow this up like we've done on other slides before, let's take a look at some of these points. All right. So when we blow it up, we see here that, So we can see the whole thing. If we look rarely all the way up to most of the time, so rarely meaning less than 1 day a week, most of the time is 5 to 7 days a week. What are we looking at? So I was bothered by things that usually don't bother me. I felt that everything I did was an effort. My sleep was restless. And we can check off on these and kind of get an inventory as to, in that past week, where has this person been? Like in terms of like score wise, if majority of these things are on the left side of these check boxes over on the, some to rarely side, well, we're not going to be as worried about that person. Doesn't mean we're not worried about them, but it just means that, we have to be less concerned. Get over to that occasional on the right side here, occasionally to, or moderate to most of all, most or all the time, like on this right side here, that's really a cause for concern, and we got to pay attention to that. All right. So, that's just one sample of a particular, way to self-report. Okay. So what is the research going to tell us? All right. Preventive effects here. We're talking about, there is a connection between the lack of physical activity and the prevalence of mental health issues, problems, disorders. All right. And just like we talked about in the anxiety chapter and in the stress chapter, those individuals that are less active are usually at a greater risk to experience those types of behaviors. All right. And, just like we talked about before, physical activity is a defense mechanism, and it can help with risk reduction. Okay. So again, prevalence of major depressive disorders in terms of percentages, you can see here that with people who never exercise, your prevalence is upwards of 17%. In terms of their, prevalence, 17% of a potential possibility, depending upon that never exercising component. So, and as that relationship, it's an inverse relationship here. So as one goes up, the other goes down. So if exercise goes up, then if you regularly exercise, it goes up in terms of the exercise and down in terms of the prevalence. And that's your inverse relationship. All right. But as you start to become less active, you become more prevalent for depressive disorders. So what does research show in terms of exercise prescription as like a treatment? There's been decreased depression, right, in that research. There's certain factors, certain factors moderated exercise treatment effects while others did not. So it just depends on what factors you're using. All right, and then exercise was as effective as and sometimes better than traditional therapies. So that was talked about in the anxiety chapter as well, where we can use exercise as almost a medication versus actually physically giving a pill or some other type of like psychotherapy that might be involved as well. All right, and we talked about the risks of that last time. Cost, side effects, all of those aspects can really come into play. All right. So with the moderating factors here, all right, what are we talking about? A variety of exercise and participant variables that could influence or moderate treatment effects, such as exercise mode, program length, intensity, frequency, and duration, whether it's acute or chronic. Is it that one exercise bout, or is it constant exercise over the course of time? And then is there any participant variables? So up to date here, if you look, if you see here, there's a question mark. It says here on the bottom, it's difficult to draw a conclusion on, on like what the program length. It's difficult to draw a conclusion on that because of the amount of research that has not been done. Intensity, lack of research that has not drawn the right conclusion. And then race and ethnicity, again, not enough research to show that connection, that it's definitely because of exercise that these changes in depressive states will be effective. All right. But again, exercise mode, duration and frequency, acute versus chronic, age and gender all play a part in that. Okay. So with, again, working with these prescriptions and this treatment, like it says here, there's limits on treatment therapies like time and money, all right, and that highlight the need for other less costly options. So the thing is, like, we talked about expense before with anxiety, and now we're talking about again with depressive, treatments, is that these treatment therapies are not cheap. Insurance companies may not cover the full cost. Sometimes people might have to cover the full cost. So when we look at things here, it's like, okay, well, these treatment therapies, again, there's a lot of time involved. There's some money involved with it. So when we look at less costly options, if we look at exercise, well, exercise technically can be free. If a person has a good set of motivation in them to be able to push themselves forward. But when a person is depressed, we talked about some of those side effects, or some of those effects and factors of that person, is that they feel fatigued and they don't really want to put out a lot of effort, even when it's doing things that don't require them to put out a lot of movement. So exercise is going to be like kind of down on their on their radar in terms of that. So it's very, very interesting. All right. And like it says, exercise has been examined as a viable option for treatment of depression, of clinical levels of depression. So although it may not be the best in that moment, what will happen is you'll get this adaptation where, individuals start to feel like they can achieve more. Then motivation starts coming up. That fatigue level drop or elevates, to active levels where you're not so tired all the time. So you have this massive change in perception. All right. So when it comes to the dosages, again, we don't know the exact, but these are all standard from ACSM. All right. The mode doesn't matter. Remember, the mode meaning what type of exercise are you doing? Are you doing exercise for weight training, resistance training, or are you doing aerobic? Are you doing more cardio based? All right. But intervention lengths, we're talking about approximately 10 weeks. But what we're doing is we're seeing, or what's happening is we're being able to see that there's these changes that occur after about 5 weeks. All right. So again, 10 weeks long, 3 to 5 times per week, a good 50 to 85% of your max heart rate for cardio. Resistance training, we want to work more with higher intensities than lower intensities for about 30 to 60 minutes per session. And that's a good clinical dosage of exercise that we want to see for people. Now, again, that's pretty standard for most people who are able to engage in exercise. All right. So we're not really changing things too drastically from a normal person. It's more about getting them to get up off the couch or get out of bed, or kind of get out of that slump in their head and get them to do something. All right. So when we look at things like consensus statements here for exercise and depression, it's kind of the same that we saw for anxiety. Physical activity has protective benefits against symptoms of depression. Yep. The protective effects increase with greater levels. Yeah, so you saw there, like we want to have higher intensity. Well, we know that the more intensity, the greater level of physical activity is being produced. So therefore, we have better protective effects. There's a decreased level of mild to moderate depression with exercise. Pretty straightforward. Exercise may be an adjunct to the professional treatment of severe depression. Yeah, we talked about that, previously, where we said, with the treatments of clinical depression, that, exercise, it's a alternative, all right, or it's something that can be used in conjunction with. But again, people are trying to, sometimes people have to try to find the lower cost alternative, and exercise might be a good thing to turn to. And then here, the last one, optimal types and or amounts of activity are not known. But again, if we go back to the dosages, stick with what we know in terms of our own exercise. Maybe going to a boot camp program might be beneficial because then they have support of others. Maybe going to a group exercise facility, not boot camp per se, maybe it's just group exercise where it's a little lower of intensity, but the camaraderie is there. Maybe they go to a CrossFit gym where now you're with a bunch of people who are doing more higher intensity exercise. Who knows? All right, it just the person may find their own way and find the right place for them. All right. So what do we got to do to change? All right. There's different ways that we can get people to change. And, there's, 6 different mechanisms here. And the first one is the anthropological hypothesis where, like it says here, We are genetically predisposed. Oh my goodness me. We are genetically predisposed to being physically active. All right. But, all right. See, here's the but. Due to modern technology, we no longer have to engage in vigorous activities to survive. See, now this is where it gets really interesting to me because if you go back to our predated years where, like the caveman mentality and living off the land mentality where we had to, do vigorous activities to survive. Well, we had to be able to chase after animals and lift heavy things and all that type of stuff. But we are predisposed to be physically active. So with modern technology, yeah, it's a tough one. You can't just blame it on technology that people are becoming more depressed. But it sure does have an effect when technology can do more for us than it ever has been able to before. All right. But again, with being sedentary, we know that there are massive health problems, which include mental health problems that fall into that category as well. So that's what we have to look at. All right. The endorphin hypothesis. All right. What we're saying here is that when under levels of stress and depression, especially during stress, we know that the body produces endorphins. All right, and like it says here, endorphins are natural painkillers. They change the complexity of our system to make it feel like something that is stressful is actually producing a euphoria or a high feeling. All right, so what that might entail with that hypothesis is that if we know that stress through exercise increased endorphins should decrease or reduce the amount of depression that a person may have. So by producing more endorphins, we potentially knock out that ability to become depressed. All right. The next one is the monoamine hypothesis. And with monoamines, again, they're neurotransmitters, and two of them, serotonin and norepinephrine, okay, and both of those basically are, again, they're neurotransmitters and they cause changes in the brain. Serotonin being more, happiness, and norepinephrine being more fight or flight. Adrenaline meaning more, more intensity. And so, because of that, effects of exercise on depression are due to altered brain neurotransmitters like serotonin, uptake, an uptake in serotonin and uptake in norepinephrine in those receptors, so that you can have a change in brain chemistry, which then therefore alters your mood state. It makes you feel like you're doing something that's good for you, and it gives you that pump, that little bit of oomph with that adrenaline. Okay, with the mastery hypothesis. So what we're saying here is, as we get, mastery is just feeling, when you master something, you're feeling accomplished in the fact that you've completed a task. So when you master something, that means you've completed the task numerous times, and that ultimately means that you start to feel more accomplished. You feel a little bit better about yourself. So what we're saying is that mastery will give us a better sense of self-worth, and it'll give us a better control over our environment for ourselves, that it ultimately can, I won't say want to wipe out depression, but it can, diminish the effects of depression on us. Okay. And then the other two, the affect regulation and the social interaction hypothesis, there is some more research that's needed for these, but basically what we're saying, affect, or that affect is more about emotional state. Social, is more about how the interaction with people, and they're great hypotheses, but ultimately there's more research that needs to be to show that with exercise you can have a change on your feeling regulation, and then you can have with exercise how you interact socially. How does that work? All right. So unfortunately, there's not enough research to indicate that this is going to be a worthwhile hypothesis yet. But I have a strange feeling that based on what those two things mean, in terms of affect, and then social interaction, it's more about the feelings. With exercise, we should have a change in how we feel about things, right? Or how we have a regulation of feelings on certain tasks, all right? And then the social interaction hypothesis, what we're saying there is that, again, there's that factor of exercise and how it makes with you, how you interact with your environment, how you interact with your peers, things like that. All right. So this ends the whole week for depression, anxiety, and stress. So again, looking back at everything, we want to make sure we pay attention to everything that we talked about in here, not just what is on the slides themselves. So if you have to go back and listen and jot down notes about things that were not on the slides that maybe I talked about, then make sure we do that so we catch all components. All right. So again, this is the end of week 3. I hope everybody, has paid attention to this and kind of found some enjoyment in it, because it's a little bit different than just kind of talking about how exercise is really just good. Okay, we want to show that exercise can affect changes in emotions and mood states. All right. So I hope everybody has a great weekend, and we'll be back at it on Monday, where we actually will be in class. So have a great weekend and hope to hear from everybody soon.